My name is Brian Elbel. I am an associate professor at NYU School of Medicine and the NYU Wagner School of Public Service. I'm also director of our school's obesity program and assistant dean for strategic initiatives here at NYU Langone Health. So I'm the new editor of the 12th edition of Jonas and Kovner, Healthcare Delivery in the United States. Really excited to be in this role. I bring a little bit different perspective that maybe hasn't been here since Jonas was one of the original editors many editions ago. That's really more of a kind of population health and public health oriented perspective. So I'm really excited to bring my perspective to this book that is clearly a classic in the field and has been used and updated many times over. Students understanding health administration, health policy, nursing, population health, public health these days, for all of them, this text is really unique and really does bring the kind of broader population health perspective that's inherent in many of these fields with the kind of classics in the field more generally. So I think this iteration of this book is really meant to, as it has in the past, be a great resource for the entire semester here. We really try to think about the content in really relevant ways, both from how the professor is going to be teaching this course, but also for the students, right? We start with the policy and what are the bigger picture kind of implications of some of this work. How do we think about prevention? How does it move into kind of health services more generally? How is the triple aim a key component of how we think about all of these things? All of that's really relevant and core to how we think about the book and its structure and flow. At the same time, we really tried to find chapter authors here who are leaders in their field, who come to this with unique perspectives. We have made sure that all the content is relevant and is updated and is going to be very cutting edge for the students and really kind of speak to them and how they are approaching this problem and how they are thinking about many of these problems as part of their daily life. We've tried to be really kind of relevant and cutting edge with case studies, audio content, digital content. How is this going to be increasingly relevant to students and meeting them where they are, and how do we kind of make the content as relevant to them as we can while still providing some of this kind of core content, whether that be for nurses, public health, health administration, or any practitioners in those areas. We also think this book is one that could be used in non-traditional settings as well. This is something that you can use as part of the kind of traditional multi-week semester. You can use this in a kind of a compact, a couple week course. You can use this in multiple day-long courses. It's really meant to be as flow well, but also be as flexible as possible, so students can, instructors can use these in whatever way works for their unique teaching scenario. This book is how each of the chapters are built, right? They're meant to flow, or they're meant to sort of be used as almost standalone chapters in many cases. And I think that there's lots of additional content that we thought about as we put together these chapters. This, in some senses, extra case studies. It's audio podcasts, it's extra digital content, it's particular case studies for groups like nurses. And so we think all this is going to come together and really allow the instructor to put together the course in the best way that they deem right. And whether or not that's a particular course slated more at the health services, I think we have that pretty well covered. Could be one that's more population health oriented, more nursing oriented, and we can kind of grab any combination of those things to really kind of make sure the course meets the biggest needs that it can. Yeah. As part of our work to keep this as relevant as possible, we have an annual update of all of our ACA related content that will be updated every year, and that we think is going to really kind of keep abreast of the constantly moving health policy landscape. I think anyone paying attention to healthcare delivery, to health policy these days, has to be paying attention to population health, and I think that has been a key component of the book this round, and something that I particularly have brought to bear. I think this includes things like health equity, and how are we thinking about health equity as part of all of what we do? How are we really thinking about differential costs associated with various groups, and how can we really understand the care delivery and the costs associated with them? How can we improve those outcomes? How can we think about improving those outcomes in a way that also improves health equity? How can we really use data in a different way to help understand population health and to think about the aspects outside the medical care system that are also really big contributors to health and outcomes, and that the medical care system is increasingly paying attention to. All of these things are woven into the book in really key ways and really reflect how we're thinking about health outcomes and how we're thinking about healthcare delivery these days. As we considered chapter authors for this round, we really wanted to make sure we considered people who would be able to bring that population health perspective to bear, and who would be able to really speak in meaningful, direct ways about the role thinking about population health has on the kinds of things that they work on. For instructors who are thinking about using this course within a school of public health, particularly for an intro health policy course, I think there's a lot that this book brings to bear that you don't see a lot of places. It really does understand the public health perspective. That's the background that I come from. It really thinks about how these broader public and population health principles are intermingled throughout the broader healthcare delivery landscape and the broader health policy landscape, and how we can make sure they're integral parts of how students are thinking about each of these various topics throughout. So it's not just like in some books where you see it kind of come in for one paragraph or one chapter and leave. It really is core to how we thought about designing and organizing the book more generally. At its core, this book really is about speaking to health administration, and since its very early roots with Tony Kovner, that has been a key component, whether that be focusing on finance, something my co-editor Jim Nickman has a deep focus on, health administration more generally, management, value. These are key components of the book and have been from the very beginning at its core, and all of those things are still there. So we still really very much designed this book to be something that a health administration student can get the core components of what he or she needs to really be able to move on to bigger and better things and have a core understanding of each of these components as they go about their work. So as part of this, we have some luminary chapter authors. Christy Lee Mack and Tony Kovner are the key authors of our management chapter, and really very much leaders in the field there. Carolyn Clancy, longtime contributor, focusing on quality. Jim Nickman, my co-editor and longtime author of the finance chapter. I think each of these folks really speak to the really quality of the academics and practitioners that we have writing in this book. We realize nurses and allied health professionals are key leaders in the healthcare system these days and are increasingly taking on really large roles in leadership, in care coordination, in understanding and pushing forward team-based care, and in population health. And we make sure that they are a key audience that this book speaks to. In some cases, that's absolutely in the core of the chapter. In other cases, it's through various case studies that are specifically targeted to nursing-related courses and that we feel like are really going to kind of round out the experience for the nurse leader, for other healthcare allied professionals that are coming to this book from a slightly different perspective as well. We very much realize that nurses and other allied health professionals are key components of the healthcare system these days. They're involved in leadership, they're involved in care coordination and team-based care. They have to deal with things like workforce shortages and population health. And I think all of these are key aspects to how we structured the chapters and how we try to think about making content for these nurse leaders and others key components of how we approach this work. At the same time, we also have various ancillary materials, particularly and directly associated with nurses and other allied health leaders, whether that be case studies or other sorts of material. We really do make sure that this is a key audience that this book is directed towards. For the first time in the 12th edition, we actually have very specific nursing-oriented case study content for MSN and DNP programs. Core to the 12th edition is really thinking about how we could bring to bear chapters and chapter authors that would be most relevant to today's healthcare and health policy landscape. For example, we have a great new chapter on politics with Rogan Kirsch and Jim Marone being two key leaders in the healthcare and health-oriented politics landscape who've been writing about this in cutting-edge ways for a really long time and bringing an amazing perspective from this work. On the health IT side, we have Karen DeSalvo, who is a federal level, ran health IT for many years and brings an amazing perspective to this, who really helps you understand how this is a key component for all that we do within the healthcare system. On the vulnerable population side, we really structured this chapter to be about health equity at its core and how we can understand key components of health equity that, again, are going to be kind of sprinkled throughout the healthcare system. So the hope is that each of these new chapters are going to be kind of critical, key new perspectives reflecting the current healthcare landscape. Politics is inherent in any aspect of healthcare, right? It's an inherently political and politicalized discussion. And one of the things we really wanted to bring to bear with this book, with the politics chapter, but really more broadly, is to give students and instructors the language to talk about this in the right way, to kind of have it refer back to kind of the key political principles that relate throughout the healthcare debate. And our hope is that we've set the stage for those sort of discussions to happen in a meaningful, effective, productive sort of way, and students and instructors can understand how this really resonates throughout the healthcare system.